Hi, welcome. I'm Dr. Michelle Arnold. I'm an acupuncturist and doctor of Chinese medicine. And in my practice, I see a lot of people with shoulder pain and various shoulder problems. And maybe you're suffering with shoulder pain and you're wondering what can you do or what can you do for yourself in between acupuncture treatments or physical therapy or whatever else that you're doing. And I want to share some easy things to help you to help speed up the healing. And one of the things we want to start with is, first of all, where are you at? Like, what does your range of motion look like? So that way you can know your progress. And what is your pain level? So we always want to start with those basic groundwork levels to know, are you improving? And one of the other things I like to point out is to be patient, because natural healing time for various tissues is at least 6 to 8 weeks. So for, say, a sprain or a strain. And one of the most common things I often see for people that come in with shoulder pain, say in the front part of the shoulder, is when they're driving, is reaching back and grabbing either their purse or something and then bringing it forward like this. And then you end up with pain right here in the front of the arm. Other things are, lifting weights, doing things, in the gym, and overdoing it or not stopping when you do feel pain. So if you have pain, you want to rest it, but you don't want to stop using it, if that makes sense. There's always that gray area because you don't want to continue to injure, say, with lifting something. But one of the worst things could be to put your arm in a sling, and then you get worse and worse, and over time you end up with the inability to even use your arm. So you do want to use it. Just don't, just pay attention to how much you're lifting. And if you feel pain or strain when you're actually using it, then just stop, and try again later. The use of ice right away is a good idea, but then we get into overusing ice. Let's say if it's already been a couple days, you need to move into heat, because then you're going to start feeling more stiffness and a lack of range of motion and more of achy pain. So that sharp shooting pain initially usually lasts 1 or 2 days. Ice, 10 or 15 minutes. This is not a huge joint here. And then move on to heat and put that on 15 to 20 minutes. So let's start with some application of essential oils. Again, this is a layering technique. I use one oil, one at a time, rub it in, and I end with the vegetable oil or carrier oil, such as like fractionated coconut oil. You can even use olive oil or vegetable oil if that's all you have, but an almond oil will work just fine. And if you don't have any essential oils, then you just want to massage or rub the area, because you're going to be increasing the circulation to the area, and it feels good. So we want to start with the neck, or as far as you can reach, because the spinous processes and those nerve roots are what come out to the upper shoulders. So let's start with some lavender. I put 1 or 2 drops. I'm going to go as far as I can reach up the spine. And if you have somebody that can do that, mid part of your back is always the area that you can't reach yourself. And unfortunately, that would really be a great area for shoulder pain because of the thoracic spinous processes there, like T1 to T5 would be great also. But you do definitely want to get the C5, C6, and C7, T1 area. You can definitely reach. You can reach those with your hands. So we just put on some lavender. Go ahead and take that lavender, since you have it out. I take all the lids off so that they, makes it easy. And then just put it on your shoulder, like the whole shoulder, that lavender. Siberian fir. And I'm doing both sides of the spine, up the spine. And you can even cup your fingers and just go right along the groove of the spinous processes. And again, if you can reach your mid-back, the shoulder, the whole shoulder, and I'm saying shoulder, whole shoulder, all the way down to the elbow. Okay. The next one is wintergreen. Taking that wintergreen up, shoulder, the whole shoulder joint. Just hard to see because I'm wearing a t-shirt, but you would do the whole shoulder joint, down the front, back, elbow. Marjoram or basil, either one. Maybe you have basil and you don't have marjoram. Up the neck. Whole shoulder. Lemongrass. Lemongrass is good for tendons and ligaments. Up. Shoulder joint. Arm. Ginger. If you don't have all of these oils, use what you have. Or take note, and then you can purchase them. You'll be happy that you did. To use a specific formula, this is black pepper. But don't have any pressure on yourself. Like I said, you can do this without just getting a massage, rubbing your arm in this way. Ending with some cardamom. Up, shoulder. And then ending with a layer of your carrier oil, because that will keep now all the oils on your skin, keep them from just evaporating, because they are vaporous, meaning they turn into gas and they evaporate because they are aromatic oils. And next you can either use some massage techniques or a tuning fork. The tuning fork is a bit easier, though. Of course, it feels great if you come into the office to see me and I do it on you. So for acupressure, let's just start in the front of the shoulder joint. You can use a few fingers and just do some nice circles. You do not have to dig hard. You don't have to strain this hand or arm. If you do, stop. And just do some nice circles. As you can see, my skin is moving. Do it for about a minute on this point. And I can feel all tingly, from those oils. And then you can pump by pressing in 1, 2, 3, 4, 5. And quite often what I notice when people come in with shoulder pain, whether or not they're saying it's in the back or it's on the top or it's in the front, there's usually some really hard nodules or bands right along the front of their arm, along the bicep here. Sometimes it starts as high up here or down in here. So if you have that, you really need to just, pinch it. You've got to work that out, because then once those tight knots and bands get resolved, it seems that things really start to improve. So if you have a tuning fork, this is a 128 hertz, and I tap it, and then you can just set that here, and you would tap it 3 or 4 times, and you can even just bring it down, along that bicep, and see that sound therapy will help break up all those knots. It's this vibration here. It's the sound therapy. And it feels good. It doesn't hurt. And I'm just holding it kind of more on the end, and maybe just slightly on this part of the tuning fork, because if I don't, then I'm going to have hurt my hand. But you don't want to touch too much, on the tins, because then you stop the vibration of the fork. Another great spot is right, if you raise your arm up, it creates a hollow right on the top. And that's about there, so if you can see that. And you can feel the vibration of the tuning fork all the way down the arm or up the neck. Unfortunately, there's really no easy way to massage your back, your scapula, your chicken wing in the back of your arm. But you can use a point that's distal on the hand. So I'm going to show you one right now that works for the scapula. So it's right here. Maybe it's better if I show you my finger. So if you're holding your hand like this, just go along until it stops, and make it feel just a little achy if you press in kind of towards the bone, and imagine that this energy is going up the arm this way, the back of the arm, and then enveloping that whole scapular region. This is the small intestine channel, and this is the travel of its energy. And you can just rest your arm so that you're not holding it up or irritating it or making it tired and fatigued. And think of this as a whole kinetic chain, from the hand, the fingers, the elbow, and the arm. So you also want to make sure that everything is loose. And can you move everything freely? Like even just get the fingers moving, even one at a time. And your wrist, how is your wrist? And the elbow, are you holding everything locked and guarded? And as you just start to release everything, then that shoulder will start to, release. So you can go along and press here in the wrist, forearm, elbow, and the elbow right here into the crease. You might have some tender spots along your forearm, up to the shoulder. If you feel a tender spot here, and also the throat chakra, this particular spot right here is connected. And you can just lightly press. You don't need to press hard here because it's right in the notch of your throat. And do that for about 60 seconds. And then the chest, any tender spots, just massage for at least 60 seconds. If it starts to feel warm or tingly or numb, then you know you've done that long enough, and then you can stop. And just loosen up your arm. One of the things you can do is if you have, hang on a bed, then after you've got your oils on, you've done some massage, and then just let it hang if you're, on the edge of your bed or something, and just letting it hang and moving. Using the walking up the wall, using a hand towel between your hands to increase that range of motion. And then just try to do the washing your hair. Just keep trying to get your arms up and moving gently, and you will increase your range of motion. And this is great for a sprain or strain, tendinitis, or maybe you think you have bursitis, and often you have both. Tendinitis, usually precedes bursitis, the swelling of the bursa, and that often causes the impingement where you feel like something is stuck or your arm can't get past a certain spot. And there's other things that cause that, as well. So if you're moving your arm and you go to 90 degrees, but you have some relief when you turn the palm up, and then you can increase a little bit further, you might have, an impingement or, bursitis, or if you have pain sleeping on this side of your arm, it's bursitis. But in terms of what you can do for yourself at home with these techniques of putting the oils on, then that particular, diagnosis, you don't need to be hung up on it, because putting these oils on and doing these massage and all these different spots is going to help whatever it is. So whether or not, it's tendinitis, bursitis, all we know is itis is an inflammation, and we want to reduce that inflammation, and we want to stimulate healing. So often there's things that you need to do in conjunction with your doctor or provider that is going to speed up your healing. So I hope that this helps you. And if you have any questions, you can comment here, like and share this video. And if you have questions about essential oils or tuning forks, I'm more than happy to help. I'm Dr. Michelle Arnold, and enjoy your day.